Insomnia affects 10 to 30% of adults and is a prevalent sleep disorder, often impacting overall well-being. Chronic insomnia lasts for months or years, and this prolonged duration significantly impairs daily functioning and quality of life. Women are more prone to insomnia due to hormonal factors, especially during certain life stages, contributing to increased susceptibility in females. Cognitive behavioral therapy helps treat insomnia as an evidence-based approach, offering effective non-pharmacological interventions for improving sleep patterns. Insomnia increases the risk of depression through a well-established bidirectional relationship between insomnia and mental health issues. Persistent insomnia is a symptom of insomnia disorder and persists for an extended duration, causing substantial disruptions to daily life and well-being. Sleep onset insomnia delays falling asleep and is characterized by difficulties initiating the sleep process at the beginning of the night. Sleep maintenance insomnia disrupts staying asleep and involves difficulties maintaining uninterrupted sleep throughout the night, leading to frequent awakenings. Insomnia is linked to increased mortality risk, with research indicating a higher risk of mortality associated with persistent sleep difficulties. Chronic insomnia may impair daytime functioning as the effects extend beyond nighttime, impacting cognitive performance, mood, and overall daily activities. Short-term insomnia can result from stressors such as major life events, work-related stress, or environmental changes, leading to temporary sleep disturbances. Alcohol and caffeine worsen sleep in insomnia, as these substances can exacerbate insomnia symptoms and disrupt the natural sleep-wake cycle. Insomnia can be comorbid with other health conditions including anxiety, chronic pain, and medical illnesses, complicating the management of both conditions. Genetics play a role in predisposing individuals to insomnia, with a heritability factor contributing to the likelihood of developing sleep difficulties. Sleep hygiene practices are essential for managing insomnia, including maintaining a consistent sleep schedule, creating a comfortable sleep environment, and avoiding stimulants before bedtime. Insomnia prevalence increases with age, with older adults being more susceptible to sleep disturbances, often related to changes in sleep architecture and health conditions. Shift work and irregular schedules contribute to insomnia, disrupting the body's natural circadian rhythm and making it challenging to establish a regular sleep routine. Insomnia prevalence is higher in individuals with psychiatric disorders such as anxiety, depression, and post-traumatic stress disorder, creating a complex interplay between mental health and sleep. Medications, including certain antidepressants and stimulants, can contribute to insomnia as a side effect, necessitating careful consideration of drug choices for individuals prone to sleep difficulties. Insomnia has economic implications as it leads to decreased workplace productivity, increased absenteeism, and higher healthcare utilization. The use of electronic devices before bedtime with exposure to blue light can disrupt the natural production of melatonin, contributing to insomnia. Insomnia is diagnosed based on specific criteria, including the frequency and duration of sleep difficulties, as outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Insomnia is classified into different subtypes such as psychophysiological, paradoxical, and idiopathic insomnia, each characterized by distinct features and underlying causes. Melatonin supplementation is used in treating insomnia as it helps regulate the sleep-wake cycle, although its effectiveness varies among individuals. Insomnia can lead to a cycle of anxiety about sleep, creating a heightened state of arousal that exacerbates sleep difficulties and perpetuates the insomnia condition. The prevalence of insomnia increases during stressful events such as natural disasters, pandemics, or major life changes, highlighting the impact of external factors on sleep. Insomnia is more common in individuals with chronic pain, as pain conditions can disrupt sleep and create a vicious cycle of pain interference with sleep quality. Hypersomnia, excessive daytime sleepiness, is a rare subtype of insomnia characterized by prolonged nighttime sleep and persistent drowsiness during waking hours. Insomnia can be secondary to medical conditions including respiratory disorders, gastrointestinal issues, and neurological disorders, necessitating a comprehensive medical evaluation. The impact of insomnia extends to cardiovascular health, with research linking chronic sleep disturbances to an increased risk of hypertension, stroke, and cardiovascular events. Sleep restriction therapy is a component of insomnia treatment involving limiting the time spent in bed to increase sleep efficiency and consolidate sleep. Insomnia can contribute to weight gain, as disrupted sleep patterns may affect hunger hormones and lead to increased caloric intake. Sleep medications are prescribed for short-term insomnia relief, but their long-term use is often discouraged due to the risk of dependence and potential side effects. Insomnia symptoms can fluctuate with periods of improvement and exacerbation, making it important to monitor sleep patterns over time for accurate assessment. Chronic insomnia is associated with neurocognitive deficits affecting attention, memory, and executive functions, highlighting the broad impact on cognitive performance. Insomnia has been linked to an increased risk of accidents, with impaired alertness and concentration, making individuals prone to workplace and traffic-related incidents. The prevalence of insomnia is higher in individuals with a lower socioeconomic status, potentially due to increased stressors, limited access to healthcare, and challenging living conditions. Cognitive distortions about sleep perpetuate insomnia, with negative beliefs and thoughts about sleep contributing to anxiety and maintaining the sleep difficulties. Insomnia can be triggered by significant life events such as divorce, bereavement, or job loss, highlighting the role of psychosocial factors in sleep disturbances. Sleep apnea and insomnia can coexist, with the former characterized by pauses in breathing during sleep, and the latter involving difficulties initiating or maintaining sleep. Insomnia can impact the immune system, with chronic sleep disturbances potentially leading to a weakened immune response and increased susceptibility to infections. The prevalence of insomnia is higher in individuals with a history of trauma, as traumatic experiences can contribute to hyperarousal and disrupt the ability to achieve restful sleep. Mindfulness-based interventions show promise in insomnia management by promoting relaxation, reducing hyperarousal, and improving overall sleep quality. Insomnia is a common complaint during pregnancy, with hormonal changes, discomfort, and anxiety contributing to sleep disturbances in expectant mothers. The 24-Hour Society contributes to insomnia prevalence, as societal norms and expectations often lead to irregular sleep schedules and insufficient sleep duration. Insomnia is associated with an increased risk of developing mood disorders and exacerbating existing mental health conditions, emphasizing the importance of addressing sleep in mental health care. The impact of insomnia goes beyond the individual, affecting family members and relationships, as sleep difficulties can lead to increased stress and disrupted family dynamics. Insomnia is a complex condition with multifaceted causes, requiring a comprehensive approach that considers both psychological and physiological factors in diagnosis and treatment. Sleep disorders may contribute to insomnia, as conditions like sleep apnea or restless leg syndrome can disrupt the sleep-wake cycle. Insomnia can lead to heightened sensitivity to stimuli, with individuals experiencing increased awareness of environmental